I wanted to come back with another thought about the movie Six Schizophrenic Brothers. Towards the end of the docu-series, they talk about how the brothers were studied because this was a unique case where a large family had half of the siblings develop this disorder. So they did genetic tests and they found that the brothers that were affected with schizophrenia had a gene. We definitely know there is a genetic basis to this disorder. However, genetics and environment play into the ultimate development of schizophrenia. What do I mean by that? So, someone can have the genes, but they may never develop a disorder if certain things do not happen in their life. And this is similar to other diseases with physical health. Someone might be predisposed to diabetes, but if you eat well, you're exercising, you're pretty healthy, maintaining a healthy weight, then you may not ever develop diabetes, even though you're genetically predisposed. And the same thing can happen with schizophrenia. You might have the gene, but it may not be triggered until something happens. The family speculates, was it some emotional trauma? Was it physical trauma that might have tipped the brothers into schizophrenia because some of them were very active in contact sports like hockey and football? And could it have been drugs that they were using because they grew up in the 70s when that was very prominent? I will say the one thing that we do know are that certain drugs definitely can trigger the onset of schizophrenia if you are predisposed to developing it. Meaning, you could have the genes and never develop it, but if you use too much of drugs, and specifically hallucinogenic ones like cannabis being number one, you can develop schizophrenia. And that is something I am seeing more and more now, unfortunately, with the legalization of marijuana in many states, including where I live. I see people that are coming in with just brief psychotic episodes lasting maybe a day or two. But sometimes I've seen the same patients even a year or two later. And then they have developed full blown schizophrenia. And research has shown for many years and decades that using more and more cannabis with a higher THC content can tip you over into developing schizophrenia if you're genetically predisposed. So, one thing that I would caution about is if you have a family history of schizophrenia, and some other psychotic disorders, mainly bipolar disorder. If you've used cannabis and you feel like, oh, whoa, that made me really anxious, or I started thinking weird, or I was more paranoid, you will definitely want to reduce your risk of developing some of these psychotic disorders by reducing your use. That's one thing to keep in mind. But again, schizophrenia is a really complex disorder. Many factors lead to it, but I do want to put that warning out there because it is something that we know, and I think it's something that should be talked about a little bit more. That there are some risks with some of the drugs out on the street. I also see some psychosis with meth, definitely with LSD as well, although that's not as common. But I will say the most psychotic episodes I see in people are due to cannabis and then meth and then alcohol withdrawal.